More than 1.5 million hospital infections occur each year, and one kind of infection is responsible for about a third of all such infection deaths.
A new Consumer Reports study looks at those ICU-based infections transmitted through IV catheter devices. In Madison, St. Mary's fared much better than the other community hospital. Its 2008 rate was 0.66 per 1,000 device days. That's far lower than the national average rate of 2.4. Meritor's rate came in nearly double that, at 4.1. Still, Meritor says it's already made good progress on the issue.
News 3's Linda Eggert has perspective from both hospitals. Linda.
That's right, Susan and Eric. Both hospitals say these kind of potentially deadly infections are a top safety issue for them and one where simple measures can make a huge difference.
Inside one of St. Mary's intensive care units, 24-year-old Eggert is recovering from surgery for a burst appendix. The last thing he needs is a potentially deadly infection slipping into his bloodstream through his intravenous catheter. That's meant to feed his body good things like fluids and antibiotics.
And, instead of, getting a shot every time, they can just put it in here.
But when it comes to bad infections, Bjorndal is getting good protection, according to a new Consumer Reports study. St. Mary's rate for so-called central line infections is low, 70% lower than the national average. Only 2 patients had such infections in 2008, and last year, 0 did. St. Mary's attributes that to years of educating staff about a checklist of 5 steps they can take to prevent the infections, including frequent hand washing. Together with things like wearing masks and other protective garb, the hospital's keeping bacteria at bay and with it, infections.
The staff in our intensive care units, after hearing about the study results, they're just elated because it's proof positive that what they're doing really works.
The preventative steps like having hand sanitizers in the ICUs are standard at Meritor Hospital too. In 2008, it had 15 patients get ICU infections, a rate nearly double the national average. But last year, that number was nearly cut in half.
To have 15 infections out of several hundred patients doesn't sound like it's a huge problem. To have 8 infections is better, and to have 4 is even better, and none would be the ideal. So that even though these things occur, they are still rare.
Still, Meritor wants to eliminate them altogether as St. Mary's and says it has launched its preventative effort, or it did, as soon as it got hard data on the problem starting in 2008. The UW Hospital and Clinics, by the way, says it chose not to participate in this study because it responds to other studies and it has to weigh its resources carefully.
Linda Eggert reporting tonight. Linda, thanks.